I need birth control. Testing.
Okay, guys. It was funny the first time. Services are confidential. You don't have to worry about anyone finding out that you're here.
Really?
Don't be afraid to ask.
For many teens and young adults, access to education about sex and reproductive health is limited.
Even adults in their mid-20s aren't entirely educated on their sexual reproductive health. For instance, in the next video, these two young women describe what they remember learning in sex education and the gap of what should have been learned.
The women's health talks in school were more about like sex education and like don't get pregnant. I don't think it was based more on like actual health.
A lot of early education I can remember is like sex ed, and like it was mainly about the man, like this is a condom, this is how you use, like it was never about the woman, this is your body, this is what it does. I usually just Google things. I'm like, is this normal, is this okay, like am I okay?
Clearly, teens need answers to their questions, so where do people go when they have these questions? The internet. However, what it says about sexual health is not accurate by any stretch of the imagination, or it is so laden with the bias that it feels more like being pelted with judgment. Unfortunately, not every teen is willing and able to talk openly with their parents about sex, so if not always the internet, where can teens turn?
We decided to conduct a survey of teen females and males in Sonoma County. Overall, we hope to gain insight on the knowledge, habits, differences, and questions that people our age have about sex. Our findings were surprising. When asked if they have ever visited a Planned Parenthood or teen clinic, 14.6% of women said yes and 85.4% said no. For men, 12.5% said yes and 87.5% said no. When asked if they were to get pregnant, what route would they take? 45.1% of women said they would raise the child. 43.1% said they would have an abortion, and 12% are unsure. When we asked the men, 56.3% said that they would raise the child, 33.8% said they would choose abortion, and 7% were unsure. When asked when they became aware of their reproductive system and its uses, the most common age for both men and women was ages 9 through 11.
Why is it that sexually transmitted infections or STIs continue to be a problem among young teenagers and adults? It's not a question of whether teens are having sex. By 12th grade, 65% of high school students will have engaged in sexual intercourse. And 1 in 5 sexually active teens will have had 4 or more sexual partners. These numbers continue to rise after high school. Young people aged 15 to 24 represent only a quarter of the sexually active populations, yet they carry almost half of all STIs out there. In fact, 1 in 2 sexually active teens and young adults will get an STI before they are 25, but only 12% of sexually active teens and young adults get tested, which means a person with an STI may not know they are carrying the infection. So why isn't teen sexual health a more talked about social issue?
Teen pregnancy rates in the United States have decreased, but they are still too high. Every day, over 1,000 babies are born to teen mothers. Having a child can have a huge impact on a young person's life and aspirations. Half of the teen mothers don't graduate from high school, and babies born to teens face increased medical risks. Most teen pregnancies happen because of partners not using contraceptives at all or not using them properly or consistently. More healthcare professionals need to educate those teens about all the contraceptive options available. It is important to let teens know they can use any method of birth control and that there are no restrictions on any method based solely on a teen's age. Simply by having a conversation with a teen, you will be able to educate them and possibly prevent the negative consequences of sex.
Thomas is 17 and has a girlfriend. They've been having sex for 6 months. Although his girlfriend has an orgasm every time they have sex, he doesn't. In fact, Thomas has never had an orgasm and never masturbated. Sex for him can be painful. This story is so not believable, right?
Jane Epstein knows that there are remarkably different social expectations for sexually active teenage boys compared to sexually active teenage girls. And these expectations also manifest the attitudes and actions of her teenage patients. Jane believes it is time for this narrative to change. She believes it is time for us to talk to girls about sex. Additionally, her focus is to help young women feel empowered about their health and their choices and their sexuality.